Welcome to the first in our podcast series where we discuss issues surrounding anticoagulation and the coronavirus. I'm your host, Eve Knight, and I'm CEO and co-founder of the charity Anticoagulation UK. For those of you who don't know us, the charity is dedicated to the prevention of thrombosis. We rely on the generosity of people like you to help us achieve our mission of preventing thrombosis. And you can help us to do that by donating. You can go to our website, www.anticoagulationuk.org/donate. If you are watching us on our YouTube channel, please share, hit the subscribe button and turn on notifications, and keep following us on the audio channel that you are using. You can also sign up to our free newsletter, which has articles and news items for both healthcare professionals and for anyone who's taking anticoagulant therapy or has been affected by a blood clot. Today we have with us Helen Williams to answer some of the questions that you have asked us. Helen is a consultant pharmacist for cardiovascular disease for South East London clinical commissioning groups. She is also the clinical lead for atrial fibrillation for UCL Partners, and has recently been appointed as the National Speciality Advisor for Cardiovascular Disease for NHS England. On behalf of NHS England and NHS Improvement, Helen has recently produced the clinical guide for the management of anticoagulation services during the coronavirus pandemic, and this has become the reference point for all clinicians who are dealing with patients and anticoagulation at this difficult time. Welcome, Helen. Helen, it would be good for listeners to understand the general landscape around anticoagulation and perhaps why the guidance became such a priority.
So COVID-19 has really challenged the NHS in the way it delivers services. We want to really reduce the burden on staff at the moment because they're dealing with COVID-19 itself. We also want to minimise the risk of infection to patients. One of the issues with anticoagulation, particularly with warfarin, is the need to have frequent blood tests. And we want to minimise those where possible and also think about how we restructure the delivery to reduce the risks where we have to see patients face-to-face.
Thank you, Helen. So we're going to start with perhaps the obvious question, and the one that will probably be causing such a high level of anxiety for patients at this time. Does being on an anticoagulant make me at a higher risk of contracting the coronavirus?
So being on an anticoagulant itself doesn't increase the risk for individuals of contracting coronavirus, but there may be other reasons why they may be higher risk than the average person. So things like being of older age, having other conditions, for example, cardiac conditions like atrial fibrillation, they may all increase the risk. That's why some patients have been advised to self-isolate, and others who are particularly vulnerable being asked to do what we call this shielding, essentially staying in the house for the next 12 weeks or so. So being on the anticoagulant itself doesn't increase your risk, and you may be aware that COVID-19 has been associated with some clotting disorders. So actively being treated throughout with an anticoagulant may even be protective for people if they do develop COVID-19.
So we hear a lot about underlying conditions, and you've mentioned atrial fibrillation. What other sorts of conditions might make it more difficult for people if they catch coronavirus?
So we don't know all of that information at the moment, but the issues that are coming out are patients who have any form of cardiovascular disease, including AF, but atrial fibrillation, but also hypertension or coronary heart disease like angina. Patients who already have respiratory disease, we want to be very careful with, and those with diabetes. But because we don't know everything at the moment, we're really trying to protect anyone we think who might be at higher risk. And in fact, anyone who is recommended annually to have a flu vaccination is recommended to do this self-isolating. And patients who are more vulnerable will have been written to about shielding.
And we've heard also that patients being treated for cancer, so those with active cancer, may be more at risk.
Yes, those are in that vulnerable shielding group, patients who have active cancer, receiving chemotherapy, who are on drugs that suppress the immune system, are going to be at higher risk of catching an infection, and therefore everything they can do to shield themselves at home to protect them from catching it is recommended.
You mentioned that patients who catch the coronavirus do seem to be getting blood clots. So actually then, being on an anticoagulant already might be quite beneficial in that respect.
Absolutely. So for an average patient who goes in with coronavirus, they may develop a clotting disorder during the course of their treatment, and will obviously at that point be considered for an anticoagulant. Any patient who is already receiving an anticoagulant for a condition like atrial fibrillation, a clotting disorder, a valve, will have anticoag therapy maintained throughout. So they might be taking it orally at home, but if they get admitted to hospital, they'll get it possibly in an injectable form. So there may be a protective element to that because they're effectively pre-treated to prevent clots forming.
One of the other things that people have been worried about is that their GP surgery apparently it's closed except for telephone and video consultations. And sort of how am I going to get my INR test in that case?
So there's been a huge reorganisation of services in the NHS. If you get your INR blood test done in the GP practice, they will be looking at where the best and safest place to deliver that is for you. So it may be that your individual surgery is closed, but across geographies, what we're trying to do is set up what we might call cold or green clinics, areas where people with COVID-19 will not be sent, and so safer for people to go for routine things like vaccinations and blood tests and the things that the NHS needs to provide across the board. So although you might not get your blood test in your usual setting, some arrangement will be made to make sure you can get it in a safer setting, either within a separate part of a hospital, if you get it in a hospital, in a community clinic. And if people are shielding, most places are trying to ensure that individuals can have their blood test done at home.
So they will be contacted by their GP surgery to arrange this new service.
They should be contacted proactively to arrange this. There may be a change in the date and the venue, as I've said, but if you are due a blood test coming up in the next sort of 7 to 10 days and you haven't heard if there's been a change to the arrangements, I would give them a call just to see what the new arrangement might be. I wouldn't call if your next test is 10 weeks away, but if it's coming up soon, just in case, because there's been a lot of moving around of services, we want to make sure nobody slips through the net. So a prompt from you will also help if you haven't received the information beforehand.
Other people have been asking, they go to a hospital anticoagulation clinic and they're understandably worried about going into that sort of hospital environment where they might be more at risk of catching the virus. What's being put in place to stop that?
So I can understand why people might be hesitant about going up to a hospital at the moment, because everyone's really worried about COVID-19. But the way hospitals have been organised is to have sort of red zones where patients who may have COVID-19 are being treated, and green zones or cold zones where patients who do not have COVID-19 and need routine hospital investigations or treatment are being treated. So it's almost like running two separate hospitals in parallel. One area where our COVID-19 patients are treated and one area where those that don't have COVID-19 are being seen.
And obviously, if you do go to any of these venues in primary care or secondary care, when you get home, do remember to wash your hands for at least 20 seconds, because that will obviously help.
Absolutely, and the services are set up now to ensure you can maintain social distancing, minimise the number of people who are there at the same time, so they might operate an appointment system even though they never used to. Some places are setting up drive-in INR, so you literally don't leave your car and the staff come up and take the blood, and the staff themselves will be using the personal protective equipment if they need to.
That's a fantastic innovation, isn't it? And well done to everybody who's coming up with all these new marvellous ideas at such difficult times. Another question came in that someone was caring for their relative who's got the virus, but they're worried because they're overdue for their own INR test. Who should they contact? Should they ring NHS 111 or try and contact the clinic? Or
so if they are going to need to self-isolate for 2 weeks, because if anyone in the household gets COVID-19, the recommendation is to self-isolate at home in that household for 2 weeks. They should contact their usual anticoag service to tell them what the situation is. The guidance that we've developed talks about patients who are actively infected or who are living with people who are infected. And what they will do is move your appointment back to allow you to do self-isolation for 2 weeks and then have your test at the end of that. So you're not exposing anyone to any of the staff to potentially to COVID-19, and the period at which you might be able to spread infection would have passed. And we've talked about whether it's safe to do that and appropriate to do that, and there's consensus is that people are happy to extend for a short period the time of the test.
okay, and presumably for people who were housebound anyway before the pandemic, they will continue to get their INR tested at home, albeit from people in protective equipment.
Yes, absolutely. Our housebound phlebotomy services are still functioning. Clearly, we have had to build up capacity because there are more housebound people now through shielding than there were, a few weeks ago. It's amazing how quickly the world has changed. So you should still get your tests done at home if that's where you've routinely had them. Obviously, there has been a change in the number of people who are required to have it, and we're putting more staff in to ensure that all of the people who are currently housebound, regardless of how they became housebound, are getting the right service for them.
People have also asked, will their INR levels be affected if they catch the virus? Will they go up or down, or does it not affect the INR levels at all?
So any infection, as I'm sure people will be aware, can impact on your level of INR control. So there may be some deterioration and increased fluctuation of the INR if you contract coronavirus. The recommendation, however, is because we need to protect all the staff and patients, that we would monitor the INR as soon after the infection has resolved. So we'd normally say within 2 weeks of the infection occurring, we would monitor the INR in case there have been changes in the control that would need to be addressed. If you get COVID and have some bleeding episodes, you should contact the NHS as usual for advice and support.
Thank you. I think a lot of people are very worried about how that will work. And some people have said to us, well, I've heard about self-testing my own INR levels. How can I do this? And then I'd be safe in my own home. I wouldn't have to go anywhere.
Yeah, so self-testing is an option that's been highlighted in the guidance. It's been available in the UK for quite many years, actually, but patients have struggled to access it through the NHS often, despite the nice guidance that recommends its use. It's particularly useful for people with prosthetic mechanical valves and for people who have AF. Some patients with VTE, so clots like DVT, deep vein thrombosis, and PE, may be suitable for it, but there is a slightly higher risk of lack of correlation between the self-test and the tests we get from the lab, so that needs to be assessed. But yeah, self-testing machines are available to purchase directly as a patient, but some centres and some geographies are actually providing them now to patients because of COVID-19 in order to facilitate home testing and minimise the burden on the patient and the staff in terms of having their INR checked. There are a few things that you need to consider before thinking about a CoaguCheck, a self-testing meter. And it may be that you need to think about someone in your household who can help with the testing if you've not got the manual dexterity in your fingers to do the testing, to take the blood sample yourself. You need to obviously be able to be taught how to use the machine. You need to inform your anticoag service, and I would recommend you do that before you buy the machine, in case there's some reason why it wouldn't be suitable for you in terms of giving accurate results. And most anticoag services, in fact all the ones that I know, are very supportive of patients doing self-testing where it's appropriate for them.
So if you are thinking that this might be a good idea, you should contact your anticoagulation service and discuss it with them.
Absolutely, just so that they can make sure you're aware of all the issues that it involves, that there are no clinical reasons why you shouldn't do it, and also to make sure they're lined up to change their way they work, because you'll need to be providing them with your results and they'll need to be advising you on your dose. So they need to be teed up to expect that.
Another question that's come in is, I have antiphospholipid syndrome. Am I more at risk of getting the coronavirus? And should I continue to take my anticoagulant?
I certainly think that we should be advising patients to take all of their medicines as prescribed. Anticoagulation is one of a number of medicines many people will be on, and it's important that we keep taking the medicines at the moment in order to stay as healthy as possible, so we don't end up in hospital for other reasons. So certainly take your anticoagulant. It's protecting you from clots like a deep vein thrombosis or a clot in the lung, a pulmonary embolism. Make sure you get supplies and keep taking it. As we've said, we've hypothesised it in itself, the anticoagulant might protect you from some of the consequences of COVID-19, and it certainly won't increase your risk of catching COVID-19 by taking the anticoagulant.
Several people said they had antiphospholipid syndrome, but they were also taking immunosuppressants, and they'd heard that anybody who has taking immunosuppressants is more at risk. Should they continue to take these tablets?
So if you're taking an immunosuppressant, it's affecting your ability to fight off infection. So your risk of catching COVID-19 is higher than the average person. However, I wouldn't recommend you stop taking the immunosuppressant. What you need to do is take those steps of shielding to protect yourself from catching COVID. So isolating yourself within the house, utilising the voluntary services if necessary, neighbours and friends to do your shopping, and ensuring all of those steps are in place, like the hand washing you talked about, to minimise the risk of infection to you during this COVID-19 pandemic. But please don't stop taking your medicines, and certainly don't stop taking your medicines without discussing it with your GP. If you really are concerned, that's the first step to take, not just stopping the medicines.
Other people have asked, if I get the coronavirus, could I just take an antibiotic? Would that help to cure it?
So unfortunately, coronavirus is a virus and it doesn't respond to antibiotics. So all we can do in the hospital really is providing supportive measures for patients, which might be things like oxygen or ventilators if necessary. We sometimes use antibiotics in patients with COVID-19 if they get another infection on top. Clearly, if you've got a virus, you're more susceptible to other bacterial infection, and that's when an antibiotic might be useful. But yeah, taking an antibiotic to protect yourself from COVID-19, one, it's not going to work, and two, if you're on a drug like warfarin, it's likely to mess with your INR. So please don't do that.
So really the idea here then with coronavirus is that there is no cure, no vaccine at this time, and what we are doing is coping with the symptoms and trying to ease those symptoms for people who go into hospital.
Absolutely, supporting them to fight off the infection themselves. And then in the wider population, trying to minimise the spread from person to person by either shielding, self-isolating or socially distancing, depending on what group you're in, so that when we do have to go out to shop for food, etc., we're minimising the risk to ourselves and to anyone else we come into contact with.
A lot of people on warfarin have said to us that they'd heard about the direct oral anticoagulants, the DOACs. Would this be suitable for them to change so they didn't have to go and get an INR test?
It may be suitable for them, but it may not. This isn't an exhaustive list, but certainly patients who have mechanical valves can't be treated with a DOAC, they have to stay on warfarin. People with other problems with the heart valves may not be able to be treated with a DOAC compared to warfarin. And people with antiphospholipid syndrome, because we've just found that warfarin that DOACs aren't an appropriate option, appropriate treatment option for those cohorts. And there are a few other cohorts that might not be suitable. But the thing I would recommend is have that conversation with your anticoag service. If you are wondering about that, feel free to email them or ring them to say, I'm on warfarin, I know all this is going on with COVID. Is a DOAC, a direct oral anticoagulant, the right drug for me? And they'll be pretty quick to tell you whether or not it's suitable. For people with plain box standard AF, it's particularly good. And for people who have had DVTs and PEs, again, a suitable option if there's no underlying clotting disorder. So there are a lot of people in this country now treated with direct oral anticoagulants.
People are also very worried about whether there'll be enough medicines to go round. Several people have emailed us and said, I'm due to have my repeat prescription. Should I try and get that early to try and stockpile a few? Are there going to be shortages?
So a lot of work has gone on with the suppliers of particularly the newer direct oral anticoagulants and also warfarin to ensure that there is enough supply in the country. So a lot of work's been done with the manufacturers to make sure the supply is in the country. The challenge is making sure it's on the shelves of the right community pharmacy. So what we don't want people to do is to order more than normal, order before their medicine is due, and try and sort of stockpile extra supplies at home, because that will put extra pressure on the supply chain, and we can't predict that. What we do know is there is enough medicine. We need to get it to community pharmacy. I would recommend people order slightly earlier than normal. So it might be that you normally ring the doctor, they do a repeat for you in 48 hours, and you go and pick it up that day from the community pharmacy. Nowadays, we're all moving to remote consultation. Sometimes it's more difficult to access community pharmacy, particularly if you're shielding, relying on volunteers. So I would ensure that you get your request in about 7 to 10 days before your medicines run out, rather than leaving it to 2 or 3 days beforehand, just because there might be small delays.
That sounds sensible, because even though people say, oh, GP surgery is closed, it actually isn't closed. It is still open. They're trying to do much more by video or telephone, but they might be working on a reduced number of staff. So it could take that little bit longer just because of that. So that's excellent advice, Helen. Thank you.
Absolutely. It's just being a little bit more prepared than we normally would be.
What happens if people have a bleed during all this and they are self-isolating? What do they do? Should they dial NHS 111? Should they call their doctor? Should they call an ambulance? How do they cope with these things?
I would suggest that what they should do is no different from what they would do outside of the setting of COVID-19. The only exception, I guess, being the issue of if you actively have COVID-19 and have a bleed. But if you're at home self-isolating and shielding and have a bleed that requires medical attention, a minor bleed, so you might contact your local GP surgery, and a more major bleed, you might need urgent care or the ambulance service. So those services are still there for people with or without COVID-19, and we just need to make sure that people are using them, because actually our experience in the last 4 weeks or so is that no other medical conditions exist anymore. People aren't seeking advice if they have heart attacks and strokes, which is very worrying for us in healthcare, because we know the strokes and heart attacks are still happening. It means people are not seeking medical advice and therefore suffering with the potential consequences. So please use the NHS as you normally would. They might advise you in slightly different ways. So as you said, it might be a telephone call, a video consultation. Initially, there'll be some triaging done to make sure you don't have COVID-19 before any face-to-face visits. But it is still there. Use all the usual routes you would, depending on the severity of the bleed.
Yeah, I think it's really important that people remember that if you have an emergency, such as you think you might be having a heart attack, experiencing chest pains or the signs of stroke, you must dial 999. Hospitals are open and they're still working for anybody who doesn't have COVID-19.
And actually, the non-COVID sides of the hospital are quite quiet at the moment, because people have had this impression that the NHS is trying not to see people. we're trying not to see people face to face when we don't need to, but if you're having a heart attack or stroke, we clearly need to see you and treat you. And the faster we know in those particular conditions, the faster you seek help, the faster we get the right medicines and interventions to you, the better the outcome. So do call, don't delay, and the NHS is still there working for people who don't have COVID as much as those that do.
Yeah, with the reduced numbers, we're likely to see quite a rise in disability from people who haven't called for help in time.
Absolutely, and it'll take a little time for our data to catch up with that in terms of knowing what the consequences of people not seeking help are. But you'll see many, if you've seen the press briefings from the government every day in the last week or so, they've repeatedly mentioned the need to utilise the NHS for non-COVID conditions, particularly for emergencies, so that we don't end up with an adverse consequence, unintended consequence of all the work we're doing on COVID-19.
Exactly. Somebody else asked if they were physically sick and vomiting, how will they know if their anticoagulant is still working?
So this is always a little bit tricky because it depends on the person, but normally I would say take your medicine as usual, as much as you can. And if it goes on for more than 48 hours, then seek advice from your GP in the first instance. Make sure you're drinking plenty. Hopefully the vomiting will settle down. But yeah, if it's going on longer than that, we start to worry about dehydration and all sorts of things. So do speak to your GP after more than 48 hours.
Yeah, somebody asked that they were taking their anticoagulant, but sort of 20 minutes later they were being sick. Should they take the anticoagulant again?
We don't recommend that you double up on the dose, obviously, because it increases the risk of bleeding. It's always very hard to know how much has been absorbed over the first half an hour or so after the drug is taken. But because we can't really measure that, we just have to hope that enough of the medication has got in. And obviously don't do that for a week, 10 days. After 48 hours, if that's happened 2 days in a row, then we really need to put in some kind of plan for you. It might be giving you something to stop you vomiting. It might be something to treat an infection if we think that's what's causing the vomiting.
What happens if somebody was due for a review of their anticoagulant medicine to decide whether they still needed to take it, whether it was suitable for them? Will that still happen?
It should definitely still happen. If the patient was, say, on a 3, 6 month or a year's course, and it's coming to the end of that course, then we would anticipate that the review would happen as normal. It might be via phone or a video consultation. If there's an issue with getting the appointment scheduled and it's delayed by a month, you should just keep taking the anticoagulant until that appointment happens. But I wouldn't anticipate that you're suddenly going to be left for an extra 6 months without anyone reviewing your anticoagulant therapy. Our anticoag services are working as hard as they can, really, to avoid real impacts on patients in terms of the medicines they're prescribed and the service that they're delivered. So yeah, I would expect it to happen as normal. You might get a phone call or an email about changes in how, but certainly I would expect it to happen.
What about if people are expecting a baby? Lots of mums have rung to say that they're worried they won't get their regular checkups. Will this still happen whilst they're pregnant? I mean, they're injecting low molecular weight heparin, obviously not taking warfarin.
Absolutely. Whatever the form of anticoag, you should be getting the right monitoring, the right assessment and the right information from either the anticoag service or the maternity service, depending on who's looking after you. Maternity services have obviously had to address some quite significant challenges because they need to scan pregnant women, and that's very difficult not to do face-to-face. So they are actually seeing patients face-to-face, but things like the provision of the low molecular weight heparin and the assessment of that, I think that should be easily done remotely, or by phone or by video consultation. But people shouldn't expect, that there should be any breakdown really in the overall service they're offered.
And again, if you have to go outside your house to receive a service, then again, when you get back home, just remember to wash your hands thoroughly. I think it's so important. Even if you think that, you know, you haven't actually touched anyone, or it doesn't matter, you need to wash your hands
properly, using the right technique.
Properly, yes. Sing happy birthday.
We don't normally
yes.
do. Yeah.
Yeah, 20 seconds.
Pretend you're going in for surgery.
Absolutely. How important it is for people who are staying at home for whatever reason, self-isolating or just worried and deciding to stay in, to get exercise when they're on lockdown.
Really important to keep moving, not just for our physical health, but also for our mental health, even if it's just a stroll around the garden or even within the house doing some chair-based exercises. So I would encourage people to take the opportunity to do their hour of exercise, or even half an hour, or even 50 minutes if that's all they can do. But also do what you can in the house if you can't get out, if you're shielding, to keep active, to keep the blood flowing, to keep the heart pumping, stop clots forming. It's really important to do some gentle activity, or you can join one of those videos. There's all sorts of things online now, isn't there? Yoga online, you can TV programs, you can join Joe Wicks.
You could even learn ballet online.
There you go. So whatever you like, virtually, there's a service that will provide it for you. But for many people, it's as simple as going for a walk, enjoying some fresh air, and just gentle exercise to keep the mind and body healthy.
But even as you say, if you're less mobile, whether that's through a condition or through age, you can still do some simple chair exercises, which just keep the blood flowing. And if you're able to move around, just put on your favourite music and dance around the kitchen. That's my recommendation.
Absolutely. Anything you do to keep active and mobile is beneficial. The more sedentary we are, the more we sit, the more immobile our muscles become, and ligaments and tendons, and the more difficult it is to move. So activity is important.
Thank you, Helen, for joining us today. And thank you to you for listening. We hope it has answered some of your questions around anticoagulation and the coronavirus. Stay well, keep safe, and keep looking out for our future podcasts. Thank you.